This would be what? Pulmonary trunk?
Yeah.
The pulmonary trunk.
And then the right and left pulmonary arteries, which branch, okay. This would be what, coming in?
Something vena cava.
Vena
Superior.
cava.
Superior vena cava, and the two, this isn't very clear cut either. Oh, this is not clear. Look at this brachiocephalic.
What brachiocephalic?
Yeah, that's what I'm thinking.
There it is.
Oh,
There should
no
be a-
right. There's a left, but no right.
Yeah, there should be a right and left brachiocephalic vein coming in. We'll show you on the cadaver. How's that? To the superior vena cava. They didn't do a good job on this.
They did a good job on the cadavers.
Yeah, but whoever made this model had some problems. Okay, so we have the descending aorta. In the upper part of the body, it's called thoracic aorta. And it gets down here, it's abdominal aorta. And the first branches are these along the midline. You know what that is? We'll do it on the big model there.
The ciliary trunk,
That's right. Do you remember the branches of it?
renal arteries?
No,
Those
renals are down here.
The branches not on there.
Anybody want to try for it? My class is supposed to know it too.
Splenic.
Splenic, yeah.
Gastric and common hepatic.
Right, there we go.
For us.
And it's on that sheet of vessels to know.
Okay.
And then the next one would be the superior. I'll need to say it a little bit more, I think, here.
Yeah.
Mesenteric. And then the inferior mesenteric. It's going to be here. And those serve the GI tract. Superior, the upper part, and the inferior, I guess, more the lower part. And then we have the renal arteries, not shown very well here, coming off to the kidneys, okay? Now, let's look at the aorta here. What are the first branches off the aorta?
It's the two that, I forgot the name.
Two branches, the first branch is off the aorta, after it comes out of the heart.
Oh,
Starts with a B.
vertebral.
No,
Right? It starts with a B, right?
nope.
No, that's above. There's two that come out.
The C.
Think heart.
Cardiac. Something.
Close.
No.
Left and right.
Common.
Left and right coronary arteries that
Yeah.
feed the heart, okay?
They're right
Right
here.
in there, right in there, just where the aortic semilunar valve is, okay? And we'll show it on the other thing. And
See on the outside of the ABCs. I'm getting
that's at the aortic arch.
Okay,
That's
we're
after
lower
the
than that. Okay.
We're right at the beginning.
Okay.
And then the ABCs,
I thought we were.
aortic arch, brachiocephalic trunk, left common carotid, left subclavian. And the brachiocephalic trunk then divides into the right common carotid and the right subclavian. As the subclavians pass through the shoulder area, what do we call it?
Axillary.
Axillary. When it gets into the arm, we call it the
Brachial.
brachial. And then when it gets down here, we have the
Radiant.
radiant ulnar. That's kind of nice. And then a lot of anastomosis down here. Now, the brachial is often used for blood pressure. The radial is often for taking your pulse. Okay. Now this, as we get down the end of the abdominal aorta, it branches into the what?
Common iliac.
Common iliacs. And when you hear the word common, think there must be two branches. of these.
External.
Internal and
External.
external. And external, when it gets down here, in the thigh would be the femoral. As it goes by the knee region, we call it the popliteal. Then we have the posterior tibial, anterior tibial, and the peroneal somewhere. Okay. And this anterior tibial, when it's in the foot, it changes names. It becomes the dorsalis pedis, which is important for assessing whether you're getting good circulation to the lower part of the body. So it's clinically important. Okay. Now they did a lousy job on the veins here because they're missing most of them. The arteries tend to be deep because you don't want to nick them and the blood comes pulse. They're a mess. Okay. Usually corresponding to one deep artery are two veins going in the opposite direction. They're not showing them here, it looks like. And then we have superficial veins too, like with the cephalic vein, we have the basilic vein. This little stretch in here, kind of hard to see, is median cubital vein. Okay, what would it be good for?
Drawing blood.
Drawing blood or giving injections, okay. Okay, coming back up, we have the femoral vein, but we also have this big vein here that is very superficial and medial, the longest vein in the body. Right. Great saphenous vein,
Saphenous.
used for bypasses, okay? And we'll join up with the femoral.
So if there's a great, is there a lesser?
There is,
Oh, there is.
great, small,
Oh,
small. This is the great, and there's the small, but we're not gonna worry about the small. This is also good for if you have to be on prolonged IV. But since it's superficial, it's also one of those vessels that tends to get varicosities. And sometimes they just take it out, strip it, they call it, okay? But since it's a long vein, you can take it out and cut it in little pieces and use it for bypasses, if you need a lot of bypasses. If you only need a few bypasses, you can use the mammary artery. You don't take it out, you just cut one end and reattach it. It's
If
the
you're a
artery.
woman, right? If you're a woman.
Oh, why?
Do men have mammary arteries?
Uh-huh, I'm sure. Men have breasts. If you're not, you're a mammal. You're a mammal. Some men have bigger breasts than women,
Oh.
especially as they gain weight or they use a lot of steroids.
Very pretty picture.
Yes, men have mammary arteries.
But I know.
They're just a little bit different here and there. Okay, so the femoral artery is going to become the external iliac, joining with the internal to form the common, joining together to form the inferior vena cava. And you can see branches off the veins coming in from the kidneys here.
Still called the renal veins.
Renal veins. Now up here, coming back from inside would be the draining the brain.
I want to say vertebral veins, probably.
Now let's go back. Let's go back to the arteries, okay?
Jugular.
Common iliacs
Oh, yeah.
are going to become the internal and external. Which one do you think goes to the brain? Internal or external? Carotid.
Internal.
Internal, okay? And then another branch, not real obvious here to me, going to the brain is the vertebral arteries.
There it is.
They're going through those transverse foramina, you could tell the cervical vertebrae. So that enters a little traffic circle of blood vessels called the circle of Willis, or cerebral arterial circle. And we had a brain showing that. So we have the two vertebral coming up, they join to form the basilar, and that enters that little circle of Willis, along with the internal carotids entering that circle. So there's many, in case one area gets blocked, we have an alternative route. So those are anastomoses between. Okay. Now draining though, we have the dural venous sinuses. Remember those from when we did the brain? I think I've seen some blanks there.
I always have a blank stare,
Baseline.
I'm totally
facial
clueless,
expression.
okay? So the dural venous sinuses drain the blood that's been through the brain, and that's going to go into the internal jugular vein. So carotids are arteries, jugulars are veins. So the internal jugular vein is coming out, okay? The external is just doing superficial structures. But if you have right-sided heart failure, and the blood's not being pumped out of the right side of the heart, the blood backs up. And that can give you swollen ankles, or you may see distension of the external jugular vein. Now, the vertebral arteries help feed the brain, but the vertebral veins do not help drain it. They're just draining the neck structures. Okay. But the internal jugular is going to join with the subclavians. That forms the brachiocephalic. Then the two brachiocephalic, the one of them is missing from here for some reason, they form the superior vena cava, bring blood back from above the diaphragm. Inferior vena cava bring blood back from below the diaphragm. So we have superior vena cava coming into the right atrium, inferior vena cava coming in from to the right atrium. What else do we have coming to the right atrium? This dot here, probably. An opening for the blood that's been through the heart. What's the name of that vessel?
Coronary sinus. No, it's not.
Yes.
Coronary sinus.
Coronary sinus.
Oh,
Okay.
I think that was-
We'll look at it, another heart, I think, okay. So that brings blood back to the right side of the heart. Okay. This has a lot of problems, this mom.
Does that mean it won't be on the test?
It could be for limited use. There's also a bypass system here called the Azico system. Did your teacher talk about the Azico system? It's a bypass if in case the inferior vena cava gets blocked or the hepatic portal vein gets blocked, then this is another route. It usually drains the chest area, but it's also an alternative route for blood going back to the heart. Okay, let's get a real heart over there.